far as tactical strategies and techniques for engaging youth in mental health, is part of it is the personalization. I think that there's been a lot within digital health around creating content that's popular. For example, CBT and mindfulness meditation are very popular, but not appropriate for everybody. So providing a diverse range of techniques. On Neolth, we have 7 different techniques. We do have CBT and we do have meditation, but we also have things like breath work and guided imagery and art therapy. So having a diverse range of therapeutics that you're offering is going to be more helpful because everybody can then find something that works for them. As well as something else that we've found that works really well is self-care tracking. So there's a whole lot that people do, youth and adults included, to improve their mental health. And a lot of times they feel like, well, it doesn't count. I'm hanging out with my friends. I'm playing video games. I'm reading a book. All of these things can be a great way to relax and take care of your mental health. But because it's not CBT or therapy or meditation, sometimes people think, well, it can't be helpful to my mental health. It doesn't really count. And that's just not accurate. What we do on our platform is encouraging them to identify what they do for self-care, like I said, whether it's exercise or video games, whatever it is, and then actually tracking that as well. So as much as you can, showing the youth that there are lots of different ways beyond what's popular to improve your mental health and take care of yourself. Having your end user heavily involved in the development process, I think it's key. We actually have a youth advisory council that we work with on a regular basis, and they help shape everything from the way we talk about and describe what this program is to the actual features or visual design. But also specifically with youth is giving them the sense of agency. I think there's nothing worse than a product where you go in and you feel almost trapped in the behaviors that you can engage with. And we see that sometimes in mental health where you have to pick kind of, do I want to do the depression pack or do I want to do the anxiety pack? And then you feel like you need to go through the whole learnings associated with that particular program. So it feels more like a Coursera or like a school course. I have to go through all these kind of modules associated with this one pack or track. And I think that is where we see a lot of drop off. So by comparison, what we do is we don't offer tracks based on a diagnosis. We really allow the youth agency to tell us specifically what they're wanting help with, what types of practices they're wanting. And we have 7 different diverse therapeutics, so they can pick between those. They can also pick the duration. So if they're wanting content that's 2 minutes versus 20 minutes, providing that diversity for them. We don't recommend any sort of engagement as far as how many days a week the youth have to engage. I think a lot of companies think they have to engage every day. We need those daily active users, but they're then thinking about it as what's best for the company, not what's best for your user. And especially around mental health, so it's almost like physical health. When you're starting to exercise, you might not do that every single day for an hour. You build your way up to that. So with mental health, it's the same. And we actually allow the youth to pick how many days a week do you want to engage this week? They can set their goal. They can change things dynamically in real time whenever they want. So by being able to give them that agency, whether it's around how often they're engaging, the duration of the content, the type of the content, that agency in real time dynamic updates, I think that that's really helpful for engagement. And that's something that's can sometimes be missing from other digital health products.